On average, almost 10% of adolescents ages 12 to 17 report using an illicit drug within a 1-month time span, and 1.2 million report using alcohol. Substance abuse among adolescents is known to cause risky behaviors in this population, more specifically increases in teen pregnancy. The average United States adolescent birth rate is 17 per 1,000 females. The purpose of this research is to prove the correlation between substance use and pregnancy in adolescents and whether preventative interventions are useful in predicting at-risk adolescents for these behaviors. Main results of the studies I found showed that pregnant teenagers are more likely to be between the ages of 15 and 17, African American or Hispanic, and living in a single-parent household that makes less than $50,000 annually. The odds ratio results yielded that the two main substances contributing to pregnancy in adolescents are alcohol at 33% and marijuana at 13% usage in the past 30 days. The main screening tool that was utilized in the research was the CRAFT tool. The CRAFT tool stands for car, relax, alone, forget, friends, and trouble, all that could be influences for adolescent substance use. Each topic is evaluated by certain questions to determine whether they are a possible influence on adolescent substance use. In terms of screening tools, the CRAFT screening, SERP-P screening, and the NIDA quick screen are the most likely to identify substance-using adolescents and those at risk for unplanned pregnancies. Overall, sensitivities for these tools were high, with values of 0.88 for CRAFT, 0.72 for SERP-P, and 0.79 for the NIDA quick screen. A major limitation I found in this research is that no study looked directly at the male gender and their influence on teen pregnancy. Unfortunately, studies were limited to just focusing on females, which skews many results. It would be interesting to look into research of adolescent males who use substances and who also participate in risky sexual behavior. The main findings of the studies have led to impacts that need to be further explored in the future. Adolescents are at a critical point in their lives, which is why it is important to provide them with proper education and support. Nurses need to be able to identify the most at-risk teenagers to implement interventions to decrease further consequences. Substance use screening tools need to be mandated in a greater number of healthcare settings that care for the adolescent population, such as urgent cares, pediatric offices, and emergency departments.
This group's overall PICO question was, in adolescents with substance use, how do preventative interventions compared to no preventative interventions affect marginalized teenage populations between ages 13 and 18? Shar, Tara, and I have altered the PICO question in our own ways to focus on pregnancy prevention programs, screening tools, and education, respectively. Education has been shown to be extremely influential for teenagers, especially between the ages of 15 and 17. Education was seen most beneficial in areas of low socioeconomic standings, teens with divorced parents, and teens who do not receive good schooling education. 2 studies I found specifically created engaging educational seminars in which licensed professionals taught adolescents about the dangers of drugs and alcohol, especially if it leads to risky sexual behaviors. Topics covered included education on what to be aware of, like HIV and AIDS, STIs, fetal alcohol syndrome disorder, or risky sexual behaviors, as well as things that may be helpful, like the benefits of contraceptives and communication skills about conflict resolution in an undesirable sexual situation. The chart to the left covers the teratogenic effects of drugs and alcohol on the fetus as it is growing and is an example of something taught in an educational seminar. A majority of the articles found showed a significant decrease in the usage of drugs and alcohol for adolescents who received any type of education, especially if it was interactive. One limitation seen in research was that education was geared towards females only. Males could significantly benefit from education regarding risky sexual behaviors as a result of drugs and alcohol. Another limitation is that there was no follow-up studies done to see how influential these studies of education were throughout the teens' lives to early adulthood. Nursing practice could greatly benefit from this research. They could incorporate drug and alcohol education into yearly checkups to remind teens of the dangers of these harmful substances, especially on their growing bodies and brains.
We use CINAHL and PubMed to find relevant articles to our topic. Using the keywords listed on this poster board, we identified approximately 450 articles, which were reviewed and screened, leaving us with a total of 15 articles. The level of evidence of these articles varied from level 2 to level 6. My findings revealed that the framework of pregnancy prevention programs needed updates to the curriculum and should focus on finding effective ways to educate adolescents on safe sex behaviors, rather than abstinence. A big limitation I found through my research was that the 2 studies that performed interventions did not screen/exclude subjects who were on birth control. This finding is extremely concerning. This is because not screening for birth control use leaves the possibility of potential manipulation of pregnancy rates in either direction, leaving any results that were found not reliable. Another finding I felt was crucial was that, in my personal opinion, pregnancy rate was not the best data point to use to answer our question. I believe that risky sexual behavior would have been a better data point to compare when performing interventions with adolescents, because this would still signify that poor decision making is occurring in the population and there is a need for correction. My specific intervention studies did not look at adolescents who use substances, but I do not believe that the findings would have been any different if that were the case. Future researchers should aim to collect the subject group solely of substance use in adolescents and determine if there is a need in this population for pregnancy prevention intervention. The use of pre-study screening for drug use is strongly recommended for future studies and would provide researchers with the desired population group. Thank you for listening, and if you have any questions, please reach out to one of us and we would be happy to answer.